Hi, welcome to Revita Health Center. I'm Dr. Queenie May. I'm a chiropractic physician, diplomatic acupuncture, certified in traditional naturopath, and specialized in physical therapy. Many people have found that very confusing to find out who they should go for their physical therapy program. And I want to spend a little bit of time to tell you that why our physical therapy program is a little bit different from other physical therapy places that you might have gone. Because of my background, so I understand a body as a whole from understanding from a chiropractic viewpoint as a spine alignment, and also the posture viewpoint, and also because of my understanding of how the body should be performing in terms of following the right biomechanics in walking, standing, and doing any activity. So I was able to help patients to really be able to go back to daily activities without any problem, such as the sport that they enjoy, or even simply shopping with their purse without hurting themselves, or even typing at work without hurting their shoulder and neck and arm and wrist again. The most basic foundation in our physical therapy program is that we actually really diagnose the patient properly, because we always have a doctor on staff, so we always want to make sure that we properly understanding what muscle firing pattern is off from the patient. For example, if a person has low back pain, we always try to find out what's wrong with the patient first. For example, how's their posture like? If their posture is like this, automatically they put pressure right into their low back. So imagine they walk, or you've seen people walk like this at a mall. And so people like that will definitely put more pressure into their low back. So you can treat them all you want by chiropractic adjustment, by acupressure massage. The patient will come back good for business, not so good for their pain. So what we will do is actually find out why they're in this position. Maybe they have weak muscle in the front, tight muscle in the back, maybe tight muscle right here. So is this something that we need to help them to stretch out so that they can actually be able to more flexible to return other body position for themselves? And also we want to look at the tightness of the muscle as well. So sometimes the patient might be more dominant on one side, and then their posture is like this on one side. So when they walk, I mean, obviously I'm exaggerating the walking position, but the minute difference is setting the huge difference on the body, because using your body every day by walking, sitting, standing, any position that you're doing. So what happens is, if you have one side is tighter than the other and the other side is weaker, you're gonna overcompensate on one side. And a lot of time you'll notice is from patient's back, one side is a lot more stronger than the other. So if you don't fix that, again, you don't fix the cause of the problem. A lot of physical therapy places, because they usually get a prescription from their medical doctor, say low back rehab or shoulder rehab. It doesn't tell them anything about what exercise to do, what's wrong with the patient. So when they diagnose the patient, it's really not specific enough to help the patient to really find out the cause of the problem. Everything is very cookie cutting a lot of time, unfortunately. And so you will notice the physical therapy program will be a person with low back pain. Every single low back pain patient will have exact the same protocol, from sit-ups to some weight machine that they have to sit on. But again, nobody's looking at how they really stand, which side is stronger, which side is really compensating for the other. So what we will do, it will only make sense if the patient is like this, for example, they have weak muscle in the front, tight muscle in the back, tight muscle in the front. So the first thing we need to do is increase their range of motion, increase their flexibility. You can put all the strength you want in here. If this is all I got in my elbow, I can strengthen all this much, that's it. But if I can lengthen my muscle, now I have full range of motion on my elbow, now I have so much more leverage for the weight. And it's so much healthy for the joint as well. That's why you see a lot of weight trainer athletes, now they start compensating and really tight muscle, and they look kind of buff, but they also look like some primitive animal as well. And so that's definitely something we don't want. We want something that's functional, something you can use and last for a long time when you're 120 years old. And so that's definitely something you can think of. So the first thing to do is stretch out the low back, stretch out the muscle in the front. Any tightness in the muscle, we need to learn how to stretch them properly. So first, we teach the patient how to do their stretches properly. Once they know how, we send them home with the exercise. We go with tons of other exercises to do. And after that, we now absolutely we need to strengthen these muscles. But just by strengthening doesn't mean they know how to use it either. So by strengthening, some very devoted athletes, they will do sit-ups all they want. right? And they can do 5 times a week. And then they still have low back pain because they're still in this position that I'm talking about. So just by doing core exercise doesn't mean you know how to incorporate that in your daily activity. So I treat a lot of athletes, from soccer player to golf player, etc. So end up what happened is they're still in this position. So every time, as you can see, they swing the golf club and they will hurt their back. And they play soccer and they hurt their back, right? And so what you will have to do then is actually teach them not to say, make sure they have the strength for it, and actually incorporate that. And that's important not just for the athletes, for daily activities, right? So even if you are a person who sits at the desk all the time, or a person who do like to do somewhat of a workout at the gym, everything is extremely important in order for you to utilize your body properly. Now, after they know this, they know how to strengthen this, now they need to know where their pelvis should be. So teach them how to find the neutral pelvis is important, such as finding the midpoint between, not too much far back, not too much far forward, and the middle point. And learning how to do that is the key. And the tricky thing is, learning how to do it unconsciously is definitely the important part. I put all this together because I used to have low back pain all the time. And I noticed if I get lazy purposely so that I don't have to hold my neutral pelvis, guess what? I'll be suffering the next 3 days. And same thing for the shoulder as well. So if you are like this, you're compensating by using these muscles all the time. Now, these muscles are so weak because we're used to carrying book bags and sit at the desk. We're so trained to be forward, not using the back muscles. So now these have to retrain as well. So that's part of the shoulder meet core exercise, and also your ankle strength and the knee strength. So everything has to be utilized together. You can't really separate one then to the other because you don't hop around. You don't walk with 2 legs at the same time. You know, you really have to make sure everything is perfect. Then when you combine them together, then everything will work well together. And this is the physical therapy place that I think works really well. And this is where a patient can come and say, wow, I don't suffer from my low back pain anymore. Like I always tell patients, bad for the business is good for their care.